What have you been doing for degenerative disc disease? Hey, I'm Dr. Nate and welcome to my channel. Today we're going to talk about what is the best thing you can do for degenerative disc disease. My whole goal is to help you live well, get strong, and live your highest quality life. So there are a lot of different opinions when it comes to degenerative disc disease, and a lot of people just think it's gonna get worse and you can't do anything about it, and that it is a terrible thing that cannot be helped. Well, I'm here to tell you that that is not accurate. Degenerative disc disease is a normal part of aging, and there is a lot that you can do to help with symptoms that you might be having. So if you're having centralized back pain, there are a lot of things you can do, and we want to start with movement. Movement that you can do comfortably, or a little bit of discomfort is okay. You're not damaging something more in most cases. So I'm going to go through a couple different movements that you can do. So first one would include cycling. This is an arm bike or Aerodyne bike. So you can use your legs and your arms on here if you have access to one of these. This is really great, can get your cardiovascular system going. There are other types of bikes too, like a recumbent bike or an upright bike. So if bending forward is not comfortable, then being on the upright bike might not feel too great, but if you do feel more comfortable sitting up tall, it can. Recumbent bike can be a great way as well. So maybe you don't start with 10 minutes, maybe you just start with 5 minutes and see how you tolerate it. And then over time, you can start to increase how much you're doing. The next thing we've got here is a treadmill, right? So might not have a treadmill, but it's getting into summertime as I'm filming this video, and walking can be great, right? So if you have back pain and you're unable to walk, I get it, but see if there's a duration of time that you are able to walk without symptoms getting too severe. So see if you can walk for 2 minutes. Maybe you can walk for 5 minutes. Maybe you can walk for 10 minutes before symptoms really start acting up. You want to find what that threshold is, and once you've found that threshold of movement that you can tolerate, then you can start to try to add a little bit per week. So that can be really helpful if you have like a smartwatch. I've got a Garmin, the 245 Forerunner. It's great, it counts your steps. You can also get a Fitbit. Some of the newer Fitbits are just amazing too. They have a great interface on the phone, can be super useful. So I do recommend those two. Maybe I'll put some affiliate links below. I might have them below, so you can check those out if I have them. We'll see, I need to sign up for some affiliate links apparently. But so Fitbit, Garmin, checking your steps can be a helpful way to see how much you're actually doing throughout the day and whether symptoms kind of flare up or kind of calm down. So the two really simple things, cycling, walking. All right, let's see what's next. So another thing that you can do if you're having symptoms is to get some lifting in. Now, a lot of people are afraid to lift heavier weights, and if you're afraid to lift heavy weight, I don't recommend you start with it. Work with somebody who can teach you form that can help decrease your symptoms. And again, this is just like walking or just like cycling. You can start small and then build up from there. So maybe you start with like 5 pounds. Maybe you just start with nothing. You just get used to bending down and trying to pick things up, right? So maybe you're not picking anything up to start with, and then you can start to practice picking heavier weights up. So I have a lot of other videos on how to deadlift. I don't want to say appropriately, but with the most optimum form for force transfer. And I do have a couple videos about that. So this is not teaching forms, it's just giving you options of things to work on. So you can do deadlifts, you can do bent over rows, you can do a lot of different things. But weightlifting and lifting weights can just be a wonderful way to build confidence, build the strength of your back, and help you reduce the risk of symptoms coming back in the future. Now, if you can't do the deadlifts because it just hurts too much, you can also do what are called box squats. So you can do this with weight or without it. There's not as much forward bending, so if forward bending is uncomfortable for you, you can actually just do it this way where you're standing up from a box like so, right? Now, for some of you, this might be a piece of cake, so you can just do it where you're squatting down to the box without actually sitting. But this would be the first rendition of it, just sitting up and down. And you can see I'm not getting a ton of flexion through my back. Flexion is not bad, but if your body is sensitized to flexion, we maybe want to avoid it for a little bit while you get used to it. You might actually get some quad soreness from this. And ultimately, you know, now the error I see people make though is they'll put their feet really close together and then they'll say, oh, my knees are killing me. So spread your feet out a little bit wider, turn the toes out a little bit, and then stand up. Oftentimes that can take away a lot of the knee discomfort with squatting. Squatting is not bad for your knees, it's not dangerous. It's actually great in order to build up the quads, hamstrings, and glutes. So stretching is also a great way to loosen things up a little bit. I like yoga, so whether it's child's pose or cobra, doing a bird dog, what else? Doing cat-cow, downward facing dog. Like, if you can find yoga positions that actually make your symptoms feel better, that's great. So you want to do more of the things that make you feel better and then cut out more of the things that make you feel worse. And sometimes if everything is making it feel worse, that's when you should go to a professional who can customize your program for you. The error I see a lot of people make is they don't have a customized program. They're just going through this random program that's, you know, it's just a cookie cutter, and then they're surprised when they don't make any progress. Well, it's because it wasn't specific to you. Everyone's symptoms are different. Everyone responds to different exercise, to different movement, and different education even. So make sure you have a custom program that you're working with. And lastly, if you do need help with a custom program, please click the link in the description below and you can sign up for our customized programming for getting you back to living a high quality life where you can bend over and walk and run and do all the things you want to do without worrying about back pain. Please like this video. Go ahead and subscribe to my channel if you have not done that yet. And I look forward to seeing you in the next video. Stay strong, stay resilient, keep getting after it.